Sponsored House Bill 802 because as a physician I've seen firsthand the pain and anguish in a patient who's been diagnosed with cervical cancer, and now we have a vaccine that has the ability to prevent infection with the virus, HPV virus, that causes most cases of cervical cancer. And that vaccine is now available. It's been approved by the CDC. It's been approved by the FDA. Pediatricians are recommending it, family physicians are recommending it, and I want to make sure that every insurance company doing business in Missouri will pay for this vaccine. I want to make sure that that young women who don't have access to health insurance have access to this vaccine, and that women and parents know that it's available. This is the first time we've had a vaccine that actually will prevent some types of a cancer, and I want to get the word out.
Can you tell me a little bit about just how this would work? How young would these girls receive this vaccine?
Well, the vaccine's been approved for ages 11 to 26. And what most people recommend is that sometime in 6th grade, or when a young woman is 11 years old, that this vaccine is offered to her or to her parents to have their daughter immunized. And that's what my legislation would do. It would provide an opportunity for parents to learn about the benefits of a vaccine to prevent HPV infection, and would also make sure that this vaccine was available for on insurance plans and through the state and federal vaccine for children programs.
Does your piece of legislation make it mandatory, or is this optional?
No, there's been a lot of confusion over mandating this vaccine with an opt-out for parents who don't want their children to be vaccinated. And because of that confusion, most states, including, are doing what my legislation is doing and providing this as an opt-in, providing the information to the parents and allowing them to elect to have their children vaccinated. A mandate with an opt-out provision would allow more young women to be vaccinated, would probably cover more, but I'm convinced that an opt-in program, offering it and making sure it's available through insurance programs, is the best way to go.
And is there going to be a provision for people who don't have insurance, or parents who don't have insurance?
My legislation would make sure that the Federal Vaccine for Children's Fund will pay for children who are Medicaid eligible, to make sure this is treated like any other covered vaccine. And for the group of young women, young girls between around age 11 who don't have Medicaid, who don't have private health insurance, the state would come up with a program to make sure they're vaccinated as well. Now, we can do this without spending state money because the Missouri Foundation for Health has given a grant of $11 million to provide this vaccine for any woman who fits within the CDC guidelines, age 11 through 26, that wants to be vaccinated and doesn't have access to it through their insurance plans.
Does any other state do this right now?
Well, the Missouri Foundation for Health is the largest grant in the country for this vaccine, and we're lucky that it's here in Missouri. There are other states that have legislation similar to mine. My bill, as it's currently been amended to be an opt-in for parents who want their children to be vaccinated, similar legislation is passed in Indiana and Utah and a few other states.